There are many questions they should ask your spine surgeon before committing to surgery. First, you want to know your clear diagnosis so you really understand what is going to be done. And then you need to ask about the alternatives if they haven't been explained to you. Many times a patient comes in with the expectations of determining whether or not they are a candidate for surgery. It really depends on the patient's individual evaluation. It also depends on whether they have exhausted conservative treatment. We at Texas Back Institute believe that the vast majority of patients should be given a chance at conservative treatment. For example, most patients don't realize that 80% of patients will get better without surgery. We know that this can occur with conservative treatment over the course of 4 to 12 weeks. If a patient doesn't get recovery within that period of time, then surgery is always an option for those patients. Another common question I get asked about is, what is the difference between minimally invasive surgery and regular surgery? Well, unfortunately, this is a term, along with laser surgery, that I think is much abused. Minimally invasive surgery means using the smallest possible incision and still accomplishing the proper surgery. We know that with current techniques today, we are much more precise. We can make smaller incisions, and all of this falls in the range of minimally invasive surgery. Years ago, for an open discectomy, a patient might have a 2 or 3 inch incision. Now we can get away with a less than 1 inch incision, even for open surgery. So do not be lured in by advertisements that state that we do minimally invasive surgery with no pain, because one must make certain that rather than minimally invasive surgery, one has adequately performed surgery. You need to know the basic complications of any procedure that you undergo. For example, the expected infection rate, the expected chance of injury of the nerves, but also the expected rates of recovery for whether or not you have any neurologic deficit or for how your pain may be relieved. I'm often asked by patients, how fast will I recover? Well, with current technology, even when we do what we call anterior-posterior fusions or cervical fusions, and now that we have disc replacement as an option for patients, regardless, most patients are in the hospital usually overnight, and sometimes an extra day or 2 for the fusions. They can begin driving a car at 1 to 2 weeks, and with our newer techniques that do employ minimally invasive surgery, we are able to let the patient go back to some form of light duty work as early as a week to 2 weeks, depending on what kind of work they do. If you currently are suffering with a spinal problem, or you have other questions that have not been answered, you can go to our website, texasback.com, to the Ask a Doc tab, click on that, and then submit your question, and we'll be glad to get back with you as soon as we can. This is Dr. Richard D. Geyer, spine surgeon at Texas Back Institute.